Bismillahirrahmanirrahim. Welcome to the channel. Today we are going to talk about a very important topic, which is not only professionally important and from your examination point of view and from your clinical practice point of view, but socially also it is very important. So take today's topic as a public service message. So let's talk about hearing impaired child. What is congenitally hearing impaired child, what are its different causes, and how we can detect it as early as possible, and how to manage this. And before proceeding on, you are requested to like, share, and subscribe the channel, please. If someone is congenitally hearing impaired, he is too deaf to hear without any hearing aids, then naturally he could not imitate the speech, and the result will be that he cannot learn to talk. At least 1 in 1000 children who are born, 1 in 1000 has got no apparent capacity for hearing. Previously, the term was used deaf and dumb, which is obsolete now, because these children, they have a problem with their hearing, but otherwise they are absolutely fine. And as we know that if someone is deprived of some ability or capability, he is blessed with other abilities and capabilities even more. So that's why the term which is used now is hearing impaired or hearing impairment. Then congenital deaf mutism terminology is also a misnomer, because inborn defects of the vocal cords that make speech impossible are almost unknown, and the real trouble actually is in the hearing mechanism. So input in this case is hearing, and output is voice or speech or language. And if hearing is hampered or there is a problem with hearing, naturally the output will not be there, which is vocal response. If someone is beyond the help of any hearing aid, naturally they are being sent to special schools, and there they learn lip reading and sign language, so their own voices will never develop, and they may fit their lives to be as a handicap and then relegate themselves to a deaf mute status. Historically, these people, they were thought to be mentally retarded, and that's why the term deaf and dumb was coined for such people. Even Aristotle believed that the deaf people were incapable of learning or thinking, and this kind of prejudice Aristotle expressed for these people, it has influenced the teaching method and attitude of the society towards these children for ages and ages. Such people have existed as long as human beings are there, but they are ignored in the history till modern times. First recorded deaf person in the history is in 575 to 550 BC, and he was a son. His name is unknown, son of King of Lydia. Then in the literature also, we find this terminology. In 100 BC to 44 BC is the era. And Shakespeare's play Julius Caesar in 1599, in scene 2 act 1, Antonius is talking to Caesar, and Caesar tells him, "Come on my right hand, for this ear is deaf." But it seems to be an artistic license by the Shakespeare, because no ancient Roman literature has account of Julius Caesar having hearing impairment. So as far as etiology is concerned, hearing loss, either it may be congenital or it may be acquired. Then this congenital hearing loss, it can be either inherited genetic defect or it may be prenatally acquired. This prenatally acquired group may include non-hereditary causes like drug exposure. The mother may be affected by infections which has got a mnemonic torches, which is abbreviated for toxoplasmosis, rubella, cytomegalovirus, herpes zoster virus, and syphilis. Then another important cause can be erythroblastosis fetalis. So in addition to congenital, the postnatally acquired causes may include autotoxic drugs, infections, trauma, noise exposure, hyperbilirubinemia, and 3/4 of the childhood hearing impairment is postnatally acquired. So as far as etiology is concerned, broadly we can divide them into 4 major groups: genetic, then different diseases or illnesses, medications, and physical trauma. Genetic are inherited, and inheritance can be dominant or recessive genes. If a dominant gene is existent in a family, hearing loss will persist across the generations, because in this case this inheritance is required only from one parent. In contrast, if some family is having a recessive gene, it will not always manifest in all the generations or in all the offsprings, because in recessive genes it has to be passed on from both the parents. So autosomal recessive inheritance, 1 out of 4 is the chance that the child has the condition, and 1 in 4 has a chance that the child is not a carrier and is not having any disease, while 50% of the children, they will not be having the disease, but they are the carriers. So hearing loss, whether it is passed on by dominant or recessive inheritance, it can be syndromic or non-syndromic. By syndromes, we know that more than one system may be involved, and if someone is born with some congenital anomaly, 50 to 60% chances are there that there will be more than one congenital anomaly. So same principle applies here. that hearing loss is a component of over more than 200 inherited syndromes. Important syndromes which are associated with craniofacial abnormalities. They include Treacher-Collins syndrome, Goldenhar's syndrome, Clausen's syndrome, and Epert's syndrome. All of these syndromes except Goldenhar syndrome are autosomal dominant fashion. Hearing loss in these syndromes is either mixed or conductive type, which can be corrected surgically. Treacher-Collins syndrome, it is a genetic syndrome. Craniofacial birth defects are there. There will be downward slanting eyes, small lower jaw, and malformed or missing ears. In Goldenhar's syndrome, three culprits are blamed: exposure to hazardous material or chemicals, different viruses during pregnancy, and of course it can be hereditary as well. And its features are facial asymmetry, and one or both small pinna and ear canals. Epert's syndrome is manifested as progressive renal insufficiency along with progressive sensory neural hearing loss and ocular abnormalities, and this is X-linked dominant inheritance, and it is more common in males. Hearing loss along with visual loss is a devastating combination, and there are different syndromes in which this combination is present, like Usher's syndrome, Elstrom's syndrome, Cockaine's syndrome, and Refson's disease. All these are autosomal recessive inheritance, and retinitis pigmentosa is associated with all these syndromes except for Cockaine's syndrome. Cardiac dysfunction along with hearing loss is seen in Jervell and Lange-Nielsen syndrome, which is again autosomal recessive inheritance, and there is a conduction defect resulting in a prolonged QT interval on ECG, and clinically it manifests as falling spells in which patient gets fainted, or there may be even sudden death. Hearing loss with endocrine dysfunction, a very good example is Pendard syndrome, in which there is an error in thyroxine metabolism and it leads to clinically palpable goiter along with profound sensory neural hearing loss. Certain skin abnormalities along with hearing loss, they are seen in Waardenburg's syndrome and Leopard syndrome. Waardenburg syndrome will be associated with either dystopia canthorum, which is also called telecanthus, or there may be no dystopia canthorum or absent dystopia canthorum. If there is no dystopia canthorum, there are more chances of hearing loss. Dystopia canthorum and telecanthus, it should be differentiated from the term which we call as hypertelorism. I come to that in a while. Telecanthus and hypertelorism, they are associated with multiple congenital abnormalities. Now, the distance between the two medial canthi or inner canthal distance is called as dystopia canthorum or telecanthus, where the distance between two pupils, interpupillary distance, it is called as hypertalorism, or even we can measure outer canthus distance as well. The Waardenburg syndrome manifests clinically itself as dystopia canthorum, then of course hearing loss, white forelock on the forehead, that is the early graying of these hair, high broad nasal root. Cynophrys is there. Cynophrys is none but the fusion of the two eyebrows, as you can see in this picture as well. And then there can be depigmentation of the skin and heterochromia iridis, in which different colors of the iris will be there in the patient. While leopard syndrome, it has got cardiocutaneous lentiginosis syndrome, that multiple lentigenes are present there. ECG will show conduction abnormalities, ocular hypertalorism, abnormalities of genitalia with retardation of growth, and of course hearing loss will be there. Certain metabolic syndromes, especially the mucopolysaccharidosis, are frequently associated with conductive or mixed type of hearing loss. Then chromosomal abnormalities, especially the trisomy 13 and 18, are often associated with hearing loss. You are very familiar with Down syndrome. Mostly it is also associated with mixed type of hearing loss. So these were the few congenital syndromes which are associated with hearing loss. When different diseases or illnesses can cause hearing loss in the baby. Any high-grade fever due to any cause can cause the damage to the inner ear. Then viral infection, measles, it is very common in childhood. It often results in auditory nerve damage. Then in addition to meningitis and sepsis, other infections like adenovirus, mumps, chickenpox, hepatitis, Epstein-Barr virus, influenza may be associated with damage to the inner ear resulting in hearing loss. Autotoxicity is very common with more than 200 prescribed and over-the-counter medications. I have separately discussed this autotoxicity and the link is there in the description. You can check it out there. Major groups which are included in autotoxic medications are aminoglycoside and cytotoxic agents which cause permanent loss, while the loop diuretics, beta blockers, salicylates, they cause reversible hearing loss. Then trauma, any physical trauma, it can damage either to the ear itself or to the brain centers. Then victims of head injury, they are especially vulnerable to hearing loss or tinnitus, which may be temporary or permanent. Then noise trauma, exposure to a very loud noise, for example 90 decibel or more, such as jet engines of the aeroplanes at close range, or someone is working in some industry where there are heavy machines producing the noise at this high intensity, can cause progressive hearing loss. Not only the exposure, regular exposure to loud noise, even a single event of exposure to extremely loud noise especially in bomb blasts, in explosions. Military people, they are more prone to get this. It can cause temporary or permanent hearing loss. So from all these etiological factors, you may have an idea that the damage which has been done, it is there now. We cannot remove the cause now. Cause has already done the damage. What we can do is early identification of this hearing loss and rehabilitation as early as possible. So identification of the hearing loss in young children, it is facilitated by the clinician who looks carefully for a family history of hearing loss and who is attuned to the many syndromes associated with this hearing impairment. And of course, the complete otological and auditory evaluation of these children is essential. So with that, we come to conclude this session, and we will continue this discussion, and in the next session we will see which tools are there to identify this loss as early as possible and how we can do the management of such children. Please like and subscribe the channel, and thank you very much for watching.